My name is Ashley and this is my medication administration video. So the 6 patient rights are right patient, right medication, right time, right dose, right administration, and right documentation. So I want to check my medication administration record with the doctor's orders. Okay, warfarin 2.5 milligrams PO, warfarin 2.5 milligrams PO. And the class of warfarin is an anticoagulant, and it inhibits the synthesis of vitamin K dependent coagulation factors. And I'm giving this to this patient because of her past medical history, which is type 2 diabetes, hypertension, atrial fibrillation, and she also just had left hip surgery within the last 24 hours, so she's at risk for clotting. And the side effects of warfarin consist of petechiae, which are the rupturing of small blood vessels underneath the skin, ecchymosis, which is bleeding, hematuria, which is blood in the urine, hematemesis, which is blood and vomiting, and dark tarry stools. I also want to watch her lab values of the prothrombin time and the INR. And the last time that her values were checked, her prothrombin time was 18 and her INR was 2.2. And for a normal, someone who wasn't on the medication, the normal values is 1.3 to 2. But for someone who's on Coumadin, 2 to 3 is within the normal range, and hers is within the normal range. And I also want to watch her heart rate since it does affect her atrial fibrillation. And so I would go into the room with my patient.
Come in.
Hi, my name is Ashley. I'm a student nurse here at CMO, and I just came to give you your medications. Could you go ahead and tell me your name and date of birth?
Miss Jenkins, and January 7th, 1947.
Okay, great. Can you go ahead and wash my hands? Okay, so Miss Jenkins, so I'm just gonna give you your medications for warfarin, and it's an anticoagulant, and you're on that for your atrial fibrillation, and also because you just had left hip surgery, so you're at risk for clotting, and this is just gonna prevent any clotting for you. So, do you have any allergies?
Nope.
Okay. Are you having any pain today?
No.
Are you comfortable?
I am.
Okay, and so have you ever had any adverse effects to this medication?
Nope, none that I know of.
All right,
I
and
a little
then
nausea yesterday.
yeah, I know you had nausea. So are you still feeling?
No.
Nope, you're good. Okay, that's great. So so with this drug, there are a few side effects. So like petechiae, which are just like rupturing of the blood vessels underneath the skin, and then you'll have ecchymosis, which is bruising underneath the skin. Also hematuria, which is blood in the urine. Hematemesis, which is blood in your vomit, and then dark tarry stools, like a dark brown or reddish or black color. So okay, let's just get started. Are you ready? Okay, so I checked the drug with the medication administration record and with the physician's order. Warfarin Coumadin 2.5 milligrams PO, Coumadin 2.5 milligrams PO. Okay. And would you like to take them individually, or you want to take them all at once?
I'll take them all at once.
Okay, great. Okay, and then I'll also check my medication again with the record and the physician's orders. Warfarin 2.5 milligrams PO, warfarin 2.5 milligrams PO. Okay. And then I also want to check it a third time before I administer it to my patient. So warfarin 2.5 milligrams PO, warfarin 2.5 milligrams PO. Okay, here you go. And while she's taking her medication, I would want to know if she had any difficulty swallowing it, if it just went down good. Okay. Okay, great. So with Coumadin, it's important that you don't take aspirin because it does have many effects. It'll decrease the effects. Also, foods that are rich in vitamin K, so like leafy green vegetables, like try to keep your intake of those low and try to keep them consistent because it will decrease the effects of the Coumadin also. And don't take if you are pregnant, and those side effects just let the doctor or let me know if you experience any of those side effects that I told you. And do you have any questions for me?
Nope.
So you're good? Okay, so then I will make sure my patient is comfortable, and I would document everything I did. So I would document warfarin 2.5 milligrams TO at 1800, and then I would also make sure that it was no difficulty when she was swallowing it and everything. And my name is Ashley, and that was my medication administration video.